Thanks, Minister, and good afternoon. So on vaccination, yesterday was our second biggest day ever in the State Commission services, with 35,464 vaccines administered. There were an additional 47,000 bookings made yesterday. 25,000 AstraZeneca bookings are still available over the next 7 days, so please get in now and take those up. We've got community-led and culturally appropriate vaccination pop-ups being stood up across Melbourne. This weekend there'll be vaccinations at the Hindu temple, the BAPS Sri Swaminarayan Mandir Temple in Mill Park. That's a partnership between the Department of Health and the temple. Translators and medical staff from the community will be on site over 4 days to provide support in Hindi and Gujarati languages. These programs are proving to be incredibly successful with several multicultural communities. We ran one last weekend in Thornbury with the Greek community at their local Orthodox church. We've had similar vaccination sites for the Jewish community and the Samoan community, and it builds on great work emerging in the western suburbs, especially led by Dr. Mukesh Haikawal and others. In terms of our current cases and the geography, 96 are in the northern suburbs. That includes 54 in Hume, really the biggest LGA involved at the moment, and 18 in Moreland. 55 in the western suburbs, including 17 in Wyndham. 14 in the southeast suburbs. 11 in the inner south, including Stonington. 6 in the city of Melbourne. 3 in the eastern suburbs. 1 on the Mornington Peninsula, and 4 in Shepparton. With regard to current outbreaks, the Acquire call centre, there are now 25 cases. The source of acquisition is still under investigation. There are 700 close contacts identified. The Box Hill construction site, there are more than 58 cases associated with this outbreak, up from 20 yesterday. All sites are closed. 158 Tier 1 primary close contacts have been contacted. The Japara Bayview Aged Care in Carrum Downs, there's been one case, was vaccinated. 62% of the staff there are fully vaccinated. 82% have at least one vaccine. There's in-reach testing being done there today, and there's a local GP to vaccinate additional residents and staff in coming days. Kassar Suites in Coolaroo, one case notified on the 1st of September, now already 37 cases. Located within a busy shopping strip near Tibus Restaurant and Hassoon Cafe. And then, of course, there's the base backpackers. One staff case from Acquire resides there in St Kilda. All residents, staff and visitors are delegated or designated as primary close contacts. The case has been transferred. The partner and several at-risk close contacts are in formal hotel quarantine. There are approximately 70 residents, and alternative accommodation is being arranged for them. And then lastly, the Hume Valley School, a special needs school in Dallas, now 5 cases with 2 students, 1 staff member and 3 additional household contacts. Just a reminder for supermarkets in terms of COVID safe practices. Supermarkets and shops are absolutely essential. Everyone will go there at one point in time. They're not inherently high risk, but they are high volume for our contacts. They have a lot of human movement through there. That means many thousands of Victorians will shop alongside those who are not yet diagnosed with COVID-19. So a reminder that it's 1 member for each household once a day. Think about minimising your exposure, keeping your distance. Don't be caught up in an exposure site. If you can click and collect for your shopping, please do so. Go less frequently. Check in with the COVID safe QR code. Wear a mask and keep your distance, including when reaching over someone to get something on the shelf. Just take your time to keep that distance. We've worked closely with supermarkets, as have Department of Jobs, precincts and regions. They're extremely cooperative and helpful. They absolutely want the best for their staff, understanding the risk, customers and all Victorians, and I'd like to thank them for all of their cooperation. And really, lastly, a plea to all Victorians of any background that there are supports available. We can help you as you require it. We're continuing to see reluctance to come for testing until it's too late. That's not to place blame, that's to recognise that there are challenges for individuals, there are concerns about coming forward for testing. But by getting tested, because testing doesn't make you positive, getting infected is what makes you positive. Getting tested is what allows you to protect your family, to get early treatment as required, and to make sure that this doesn't spread any further than it needs to. If you're concerned about losing money, support's available. Go to www.coronavirus.vic.gov.au, click Financial Support on the homepage. There's the COVID-19 disaster payment if you can't work because of restrictions in place. There's the $450 test isolation payment if you can't work while you're awaiting your test result. And of course there's the $1,500 isolation payment if you have to quarantine for a 14-day period as a close contact. That's it from me. I'll pass back to the Minister. So we know that there's additional Pfizer coming. That's absolutely welcome. I understand that there's an allocation on a per capita basis, as there's been for additional Pfizer by and large. So we welcome the 25% odd that will come to Victoria. There's usually a 60-40 split between primary care or general practices allocation and state hubs, but it's all welcome. Don't have the dates. That's really to be determined by the Commonwealth on the basis of receipt of that additional dose from the UK. But of course, we welcome it. We want it to accelerate our vaccination uptake as much as possible. I would remind every Victorian there's AstraZeneca available in terms of supply. There are AstraZeneca places available in our state hubs, and there are GP appointments that can still be made, of course, for AstraZeneca and for Pfizer. So people should really bear that in mind, come forward for AstraZeneca, especially those over 60, where AstraZeneca is the only vaccine available currently for them and may be the only vaccine available for some weeks or months to come. Do not wait for other vaccines. People have concerns because they've got pre-existing illness. They say, I've got respiratory illness, I've had a deep vein thrombosis, I've had high cholesterol or high blood pressure. Those are the very conditions that mean that they should be coming forward now for AstraZeneca vaccine and not waiting. The vaccination is not more risky if you've had chronic conditions. COVID is much more risky if you've had chronic conditions. It is more of a reason to come forward and get your vaccine now, not less of a reason.
Should we read much into the fact that case numbers have gone down slightly on yesterday's? Obviously one day is not a trend, but does that signal anything?
No, I don't think it does. One day is not a trend. The trend over 7-day periods has been incrementally increasing. I expect that to happen until we can get much higher vaccination coverage. Of course, there are some settings where control of transmission is occurring, and so we get on top of those outbreaks that have had an early explosion of cases, and therefore you see the numbers fluctuate day to day. But of course, the overall trend is a slow and steady increase. That's why vaccination is so critical, and following the rules, because we know that makes a big difference, and that includes those work sites, absolutely includes transmission between households, and indeed at those exposure sites which I've called out today, and shopping centres, those other high volume areas where you can make a difference by not transmitting to someone else, by protecting yourself when you're potentially exposed.
Has there been an increase? Has there been any new transmission at supermarkets or shopping centres, considering you're calling it out today? Or is it just the fact that there's so many that are exposure sites?
We've certainly had transmission historically. We know that transmission has sometimes occurred with very little contact. We've had CCTV that's just shown transmission between people going through the same checkout within a couple of minutes. That doesn't mean that's how all transmission might occur. It doesn't make it high risk necessarily, but with literally hundreds of thousands, millions of people going through those supermarket settings every single day, we do need to say, look, make sure that you're COVID safe as much as you can be.
The Box Hill cluster going from 20 to 58 in a day, that's a marked increase. How do you categorise that increase, and what does that say about the safety of that workplace?
Look, it's absolutely an indication of COVID-19 and this virus and transmission occurring so readily. And when you're in, whether it's in an essential workplace or whether it's in any other gathering where a number of people can be exposed, especially indoors and especially in those work settings where you're there for a number of hours, the potential transmission to dozens and dozens of people is always there. sometimes the very substantial increase in numbers that we see over the course of a day is because we're suddenly doing the testing blitz of all of those close contacts. A number of those may not have been symptomatic and we're just turning them up. That said, there might be some people who are minimally symptomatic and haven't come forward for testing. That's why the reminder every single day we've been here has been that those first, sometimes very mild symptoms, runny nose, sore throat, mild cough, headache, please come forward for testing. You might be the first person in a workplace that picks it up that means that there are only 2 or 3 other close contacts who end up being positive rather than 50 or 100. It is so easy to have 100 people. Our childcare centre, My Centre Childcare, has more than 100 associated cases now. So easy to spread very substantially.
Does it indicate that it was a COVID-safe workplace? If that sort of spread is happening, and I'm thinking it's an outdoor work site.
I don't know that it is an outdoor work site. Look, I think COVID-safe practices are something you need to be mindful of all of the time in all workplaces. Nobody does it perfectly, or sometimes they're doing a great job on most days, and then again the guard is dropped on a particular day. Even in a very COVID-safe workplace, you can absolutely have transmission. The risks are there, and sometimes it relates to those engineering elements of ventilation. So an indoor space where people are in close contact for hours and hours needs to have you wearing a mask, needs to have you testing if you're symptomatic, needs to have the ventilation maximised, and if that's opening windows and doors, then that should be done as well.
Would it make you more cautious to ease those restrictions for construction on September 23?
Oh, look, the caveat for construction opening up is absolutely the high vaccination coverage. We want that. That'll be a genuine risk mitigation. But those other practices need to be in place as well. The mask wearing needs to be there, the social distancing, the checking in and the testing. But as we've seen, construction sites are not immune to transmission, and wherever people come together in relatively large numbers, the potential for accelerated transmission is there.
Well, given the contagious nature of Delta, would we be wrong not to shut down construction completely when we were trying to hard lock down everything?
We are trying to move by increments to opening up in a safe way. We'll review right through this month, as we've always done, what is reasonable and proportionate to do so. We know that people are more than fed up. They are absolutely frustrated and challenged by the lockdown that's gone for weeks and weeks. But we can move by increments, but we have to move those lower risk elements first, and we'll consider where transmission's occurring. We'll consider what mitigations can come in order to do that. But we want to move slowly by increments. We don't want to take steps backwards.
I understand moving forward, but when we did make that decision to hard lockdown to try and get it back down to zero, should we have considered shutting construction?
We were seeing primarily transmission driven by social networks and by some other essential sites. So I don't think that would have made a difference. We were seeing that emergence of mystery cases, and really that's the danger sign that getting back to zero is profoundly challenging, and I think we've seen that here. I think that's the challenge that New Zealand and ACT will face. We absolutely threw everything at it, as you know, and the reason why you aim for zero, or you aim for long-term sustainable low numbers, no people infectious in the community, is for that reason of being able to open up again. Nobody wants to be in this situation that we're in now and faced with a slow but steady increase in the hundreds. That's why you do absolutely everything to get back down to sustainable numbers if you can. When you're faced with a situation we're faced with, we're going to keep a cap on it to the fullest extent that we can, but we know that there's a long haul to go, and we need to move slowly and surely to be able to have some of those freedoms and move towards a more normal existence.
With that checkout example you gave, is there an indication of, or was that airborne for a couple of minutes? Was it a surface? And do you know what supermarket it was?
Oh, so that related way back to the Epping cluster. It was almost certainly airborne transmission. There's no indication that surfaces would have been the contamination there. And as we've said many times, airborne transmission's a risk. It's not
wearing masks.
People were wearing masks, but it still happens. And we've all seen masks not worn properly. A mask on a chin does bugger all. a mask that's below the nose is not working. We all breathe through our noses. So if you're wearing your mask over your mouth and below your nose, but breathing through your nose, that's an issue. You will transmit to others if you're COVID positive. So we can all do better, but this is an invisible virus. We don't feel the risk and the threat with someone standing next to us necessarily, because we can't see that they're unwell, and they may not be unwell. We just need to work on the assumption that we're at risk when we're in proximity to people when we've got that interaction.
Professor, we've seen some pretty high-profile influencers flouting the rules on social media and so forth. What's your message to people that are still, flouting the rules and that incident in particular?
I'm not going to comment on the incident in particular. We're all fed up. We're all fed up with being stuck at home, not being able to see friends and family. My message to anyone, social influencer or otherwise, it's the message to all Victorians. There is really only one way to protect yourself, and that's following the rules. There's no question that it's hard. The alternative is too awful to contemplate. Tens of thousands of cases could be our reality if we don't maintain, those really tricky constraints on our life. That's just the awful dilemma that we've had right through. We've held a tsunami of cases back for 20 months. It's come to us in waves. We've beaten it back in waves. We've got maybe the biggest challenge that we've ever faced, but we've also got a proper pathway out of here with vaccination. So hold the line in these last weeks and months until we get the high vaccination coverage that means that we can have greater confidence about seeing people, initially outdoors, initially in those ventilated settings and in smaller numbers, but we will get there.
So the Saturday paper said this morning that hospitalisations in the ICU ward in Victoria is perhaps worse than what has been announced. They said 91% of rooms are occupied. Royal Melbourne Hospital went to pandemic mode on Thursday. Are you concerned that with cases rising that the health system might not be able to keep up with this?
Look, I think there's a huge amount of preparedness work that's been done, and we bring online ICU beds as required, and we're planning on the basis of what the projections are. And so the ICU capacity is readied for an increase and mobilisation of those ICU beds as required. The bed availability is actually very substantial. What you need to do is activate them and have the staffing available, and that is in the pipeline, and we are ready as an overall health system to be able to do that. What I can tell you is that we've been planning for months and months. As of the 2nd of September, we've got 429 open ICU beds. We've accelerated new projects. There are recommissioned former sites you'd be aware of, and there's been the billions of dollars invested in PPE to keep healthcare workers safe. There is a new pandemic ward opening this week at the Northern Hospital. That's a ward with 28 beds, all with negative pressure control, so can manage each and every COVID positive patient. And through a stage approach, we can bring online the capacity up to 1,500 ICU beds. Of course, there'll be staffing challenges, but the principle of all of us getting vaccinated reduces the risk of transmission within hospital settings. Clearly, our healthcare workers have been vaccinated at very high rates, and there are a huge number who are fully vaccinated. But the risk of transmission to an emergency department, to a ward, to an outpatient setting exists, especially when we're not vaccinated. So we've got a role to play as a community as well, and it means not furloughing dozens of staff who are then unavailable to do ward work, ICU work, emergency work.
So that 91% is just what's currently available. More will be opening up in the coming weeks. Do you have an idea on that specific number?
I don't. I'm not the state controller for the hospital system, but we can provide some details about what might be in the pipeline.
Professor, considering that we know that cases are going up, and I know the Premier touched on burnout modelling yesterday, where are we going? Where do you think that this will peak? Do we have an idea of when we think case numbers will peak? And what type of daily case numbers are we looking at for, say, that September 23 date that we're looking forward to at the moment?
We can't say for sure when case numbers will peak. We hope that the peak is as early as possible. In part, it does depend on maximising the vaccinations available. We know there have been constraints up to this point in time in terms of supply, but with additional Pfizer being available and with the allocations of AstraZeneca that could be mobilised tomorrow, we've got an opportunity to bring that peak down and to bring to make as early as possible that peak, so that we're going into October, November with decreasing numbers and not increasing numbers. There are a lot of variables here, but vaccination coverage is the one thing that we know will limit how high that peak can get. What the Burnett modelling told us was that without the restrictions that we've got in place now, we would have seen a 30% day-on-day increase in numbers. Today would have been 3,000 or 4,000. By the end of next week, it would have been 10,000. So really substantial increases without restrictions, but even worse without the high vaccination coverage.
Obviously there are lots of variables. It's very hard to predict. I think a lot of people are a bit concerned now that we're on the same trajectory as Sydney, and we're maybe 3 or 4 weeks behind Sydney. Could we be that? Is that a scenario?
There's every possibility that we're following a slow and steady increase in the way that New South Wales has. We've got the option of being 1 week behind Sydney or 6 weeks behind Sydney. That does depend on doing the right thing. It does depend on the vaccination coverage. And I'm hoping, and I think it's entirely possible, that we can plateau, because we've got, at a relative point in time with the case numbers, we've got a real opportunity to get to the higher vaccination coverage level with a relatively lower caseload in Victoria. That is our opportunity. We have to grab it with both hands.
Our number, is it 2? Is it almost 2? And how concerning is that?
It's hard to say. If you're just following the last few days, it's closer to 2 than 1. Over a longer period of time, you get a more stable read on it. And we've had up and down. Today's a down day.
What is it today then?
I don't know today, and sometimes it's not appropriate to calculate just over a 3-day period. If you look at the longer term, we're seeing a 30 to 40% increase with each generation of transmission. That's too much. Anything's too much. Any R value above 1 is an increase in numbers. But we'll see over a longer period of time where it stabilises. I expect that we've got an opportunity to drive down. We know, we've identified again those higher risk settings and the areas where we need to focus on geographically and in terms of communities. So there's always an opportunity to drive down as you see risks emerge.
Just on schools and ventilation, what needs to happen with ventilation in schools before they can open up safer?
Yeah, as you've heard and seen the announcements, there is absolutely work going on to do the ventilation assessments in schools, which is really to see how well they are ventilated by virtue of their construction. The old schools, the newer schools, metro and regional, multi-storey, single-storey. That work's being done across all of those types of schools. The CO2 monitors basically tell you what the real world effect is of having a number of people in a room, and the build-up of carbon dioxide is really a marker for the potential build-up of virus should there be a number of kids and teachers in a room, and what the effect of increasing ventilation would do to that carbon dioxide level and therefore to the risk of viral load. So the CO2 will then give us a pointer to the changes that need to be made in specific rooms and specific schools. Will tell us in general terms what schools are at greater risk and where we might need to put those ventilation HEPA filters to reduce that risk. And they'll go in areas where the ventilation is poorest, where the risk of transmission is therefore highest. And all of that work needs to be done. Masks will be a consideration, obviously, for kids in schools, and all of those other elements that might mitigate that have been used around the world. That may include rapid testing as well. So all in play. And really what we've learned is we need that full combination of elements to be able to manage the risk to kids.
How feasible is rapid testing to you?
Sorry?
How feasible is rapid testing to you?
Well, there are some dependencies. We need TGA approval would help for home testing. At the moment, it needs to be healthcare monitored testing. That puts a constraint on how many kids you could get tested before turning up at school. But the UK's done it in hundreds of thousands of kids. If you can do it as a home test, if you can do it on a regular basis, and they're cheaper tests than the PCR tests, So with that TGA approval, with a substantial rollout of tests, with a feasible and acceptable swab for kids, and there are various types. There are shorter swabs that are more comfortable. There are swabs that sit in the nose rather than tickle the brain, that may well be more comfortable for kids.
That's your preference with TGA approval?
Whatever works in terms of having the sensitivity and specificity, so the accuracy that we know tests need to have. They won't be perfect, but what works out as a real-world feasible test for kids, if they're happy to line up for it, I'm very happy for them to be used.
New South Wales is sometimes tripling our daily testing numbers. Could and should we do more here in Victoria?
I'd always encourage everyone to come forward for testing. I saw a substantial car queue on the way in. I think people are responding. We don't want a 3-day turnaround time that has been a reality in some jurisdictions with very, very substantial demands, but we've got a lot more capacity in our testing system. So I would absolutely encourage people, do not feel like you can't get a result within 24 hours. You absolutely will. More than 99% return the next working day. So that is not a constraint on the system. Absolutely, I'd encourage people to come forward.
So we should have more. We've got the capacity.
We've got the capacity. We've not got the blowout in waiting times in those drive-through clinics. So people should move through.
Back to schools for a minute. Xavier College sent out a letter saying that they wanted all teachers getting their first dose of vaccine by term 4. Are you expecting to see more of that across schools across the state?
Absolutely. Obviously, there's the Blitz, September 7 to 17. That's for Year 12 kids in particular, but we want teachers to be part of that. We want other, potentially at-risk contractors and those attending school to be part of that mix as well. So I don't think teachers need encouragement. They understand the risk to them. And we understand what it means for them to be vaccinated to protect other teachers, to protect the kids.
Do you think there'll be a pushback from teachers not wanting to get the vaccine?
Oh, no more than exists in small numbers in the general population. There are always those who've got questions. I welcome people to come forward with questions, to speak to their GP or other specialist. The hardcore anti-vaxxers are in tiny numbers. I'm not worried about them. I am worried about people who've got questions who aren't seeking to have them resolved. They might say, this is a relatively new vaccine, so is safety really assured? The answer is yes. They might say, I've got these chronic conditions, maybe I shouldn't be getting vaccinated. The answers to those are relatively simple. You are so much more at risk of COVID-19. And if we're getting to 1,000 cases a day, that risk becomes extremely real for people, but you need the full vaccination coverage. Do not wait until we're at 1,000 cases a day to get your first vaccine, because you've then got 6 weeks to be fully vaccinated and another 2 weeks for the immune response to kick in fully. So do not delay. But those are conversations for your GP to have with you, and speak to other family members who've been vaccinated who can tell you about their experience. They're really important conversations.
Back on essential workplaces, is there anything that's being done or could more be done for proactively reaching out in especially hotspot areas to essential workers, especially younger people in their 20s and 30s who are working in supermarkets and things like that? We know that younger people have had a long time before they become eligible for vaccinations. Could not more be done for proactive kind of outreach?
There is so much outreach being done. Look, a lot of it's on Zoom. Different modes reach different population cohorts in different ways, but there are also community engagement workers, there are community leaders, there are religious and sporting organisations. We've engaged with all of them, and we've especially focused on those hotspot areas. So there's been no lack of effort in that regard. What I would say for young people is Pfizer's available for 16 and above now, and so again, don't delay. There'll be tightness in the Pfizer bookings, but AstraZeneca is also available for those who want to make that consideration on a case-by-case basis.
Professor, is there any consideration to let pet groomers operate? Vets are warning that it's leading to an animal welfare crisis.
Yeah, look, there has. It's been worked through with the team who work on the approved worker list. That's under consideration and potentially in play.
There might be a report out of the UK that recommends that healthy children aged 12 to 15 do not get a COVID jab because of a rare risk of a heart complication, saying that the risk of the vaccinations, the benefit of the vaccination is slightly better than the risk of getting the virus. Should parents be concerned about research and advice like that?
Look, we will take advice from the TGA and ATAGI on the basis of their assessments. What we do know is that different regulatory agencies have slightly different views on these vaccines depending on the caseload within a country, depending on all of the considerations that they make. What I would say about the UK determination on this vaccine is they've really not taken into consideration long COVID in kids. That's a not insubstantial burden. We know that kids don't get severe disease at high rates at all. The vast majority of children get mild disease, asymptomatic disease. I'm not concerned about kids getting severe disease in high numbers or going to ICU in high numbers. But the burden of long COVID in kids is not insubstantial. It might be 5 or 10%. For hospitalised kids, it might get to 15 or more percent. But long COVID is cognitive decline, fatigue, respiratory symptoms. That is a consideration that ATAGI and the TGA should have in mind as well as you're balancing the risks and benefits. And at a population level, the considerations of what it means to get that fuller vaccination coverage by including 12 to 15-year-olds. That's not my call, and I wouldn't pretend to be advising ATAGI. They'll advise us, and we'll accept that.
Can I just ask a question of the Minister, please?
I'm back in time a few weeks to August 4, when you posted that photo of Dean Boxall, 0 cases, and then it all changed a few hours later, and then we had a couple of outbreaks. And we were assured early on that you had your arms around them and you were very confident that they were contained. In the bigger picture now, where do you think we lost control of it?
It may well have been another incursion. We are joined at the hip with New South Wales. There are 56 border crossings on land. There were several thousand red zone returnees. There are essential workers who come in there hundreds and thousands every day. With a significant caseload in New South Wales that was increasing over time, the risk of incursion was always there. Clearly that's how it started. We drove cases down to 0. We linked each and every one of them. I think we had control of that outbreak. It may well have been that there were other incursions into the community that emerged without that early recognition of testing, without the first linked case coming to our awareness. When you've got just a few generations of transmission that's already occurred before you find out, and this is New Zealand's challenge at the moment, then you can have hundreds of cases before you know it, within a matter of a couple of weeks. So I think we got our arms around that earlier outbreak. We still bought ourselves another few weeks to vaccinate. This has always been the real benefit of crushing each and every challenge that we've had. We are trying to buy the space to get to that high vaccination coverage before we've got thousands and thousands of cases a day. If we had Delta last year and it got away from us, we would have dealt with restrictions and thousands of cases and a challenged health system for months and months and months. So those efforts are really, really difficult, and those sacrifices are really substantial. But the benefits that you get each and every time that you can drive down to 0, as we did for that earlier outbreak in July, are enormous, even as you get that next challenge. And we're in a place now where we're still doing our utmost, but we're being realistic about what the prospects are for 0.
So are we at a stage now where we just don't know how many of the cases were in the community while infectious? Is that something that contact tracers just unable to stay on top of at the moment?
No, it's not that they're unable to stay on top of it. It's that in the reporting period, when you've got 200 cases in a day, with 100 of those coming in afternoon to midnight, we're not going to resolve the status of them for 8 o'clock or 10 o'clock reporting on Twitter or for these presses.
Professor, are you confident that the regions will be reopened this week? And if so, any added measures being taken to ensure the virus doesn't seep into the regions from Metro Melbourne?
The regions are on track for some level of easing. We are always alert, as should the regions be, to the risk that's coming through. that will remain. I hope no one drops their guard in the regions. I know they fiercely protect their COVID-free status that many of them have had for a long time. In terms of managing the risk out of metropolitan Melbourne into regional Victoria, that will be managed in the public health directions as well, in terms of the limitations on movement for Melburnians. But it'll also be around the constraints on essential workers' movements and the like. So that's part of it, but a big part of it is everything regional Victorians can do to check who's coming for their food and services and visitors, and to make sure that they're other regional Victorians.
Would you reconsider a ring of steel again?
Look, the ring of steel terminology has probably been overused. We've got a different descriptor, which is probably more appropriate. It's a mobile, agile monitoring and surveillance program with VicPol that really looks at different roads and different routes out, and is probably significantly more effective. So rather than having these fixed points on the road that lead to delays, and that those who are really highly motivated to get around will just get around on back roads, it could pick up anyone at any time on any road, and I think that means we get better compliance that way. So in that sense, the ring of steel is as strong as it's ever been with that kind of approach from VicPol.
There's been a renewed push for rapid antigen testing. What are discussions with that at the moment?
Oh, we've always had an open mind about rapid antigen testing. The reason why it's not part and parcel of us as community members getting tested every day is that the PCR test is the gold standard. It turns around a result in 24 hours. In certain circumstances where you can do a relatively inexpensive test with a relatively quick result and take actions accordingly, even if you don't pick up every case but you pick up those that are likely to be infectious, we will continue to explore the settings in which that's most appropriate, where PCR testing can't do that job. But as I said, we've got some constraints on home testing or on testing that isn't under a healthcare worker supervised framework. But if we can do it under a pilot, or if the TGA comes to a determination that home testing kits with rapid antigen tests are authorised, then we'll crack on with it.
Can you confirm if that double vaccinated case in aged care that you mentioned earlier, the Japara one, can you confirm, was that in a staff member or a resident?
I understood it was a staff member.
Staff member, okay. And then you also mentioned that aged care facility double vaccination was in the 60%, 68%?
Yep.
Does that concern you that we're only at 68% for double vaccination for aged care facilities, considering what we went through last year?
Yeah, look, I would like to see it at a much higher rate. The Commonwealth has responsibility for private sector aged care staff vaccination. We'll support it in whatever way we can, and we've obviously opened up our hubs at different times for all aged care staff, and we've really pushed for them to get vaccinated. We're moving to mandating vaccination for aged care staff as well. But for anyone who's holding out for that mandate to come through, when they can get protection now for themselves, but as has been illustrated, for the residents that they've got care responsibilities for, they should absolutely do so. Our public sector aged care vaccination rates are very high, in the high 80s, but I want it to be at the highest possible rate. That'll be close to 100%. There'll be a few medical exemptions, but beyond that, everyone else should be vaccinated.
Sounds like we've got a tough stretch ahead of us in terms of cases going up. Probably our most significant one since maybe perhaps last year. I would think most Victorians will remember the point in the second wave where contact tracing fell off and became kind of ineffectual. We're completely overwhelmed. Can you give us an update? How many contact tracers do we have now? And at what point will they fall behind? Essentially, how useful are our contact tracers for the coming surge that we're expecting?
Around 2,500 staff working on all of those aspects, from contact tracing to the data entry, the epidemiological analysis, the occupational health physicians. There are so many roles. Contact tracing is supported by a huge and diverse workforce, but they are in their hundreds, indeed in the thousands. Contact tracing is most effective when you've got very low case numbers. When you've got hundreds of cases, it still does a really significant role. You identify people, you find their close contacts, they quarantine, you reduce the opportunities for the virus to spread. But we should never underestimate the role that each and every community member has in not going out unnecessarily, in not breaking the rules and seeing people, because contact tracing can only work with the cases that are identified to us. And those mystery cases that we're still seeing in significant numbers are those that get diagnosed too late, that have already been out when they're infectious. Now, contact tracing can't do anything for someone who's not been diagnosed, not gone to get that test. So it'll do a significant job, but it won't do everything.
Last question.
Just to cheat, the Premier's theory last week was that these numbers, despite this lockdown and where we think we'd be suppressing it, these numbers keep going up or staying up for two reasons, he said. But people are waiting too long to get tested with symptoms and that people are breaching the rules. Are you in agreement on that? That's how the numbers are still up close to 200?
Yeah, pretty much. I would emphasise again what the Burnett modelling told me and what I've tried to convey, that at the beginning of September, it would have been close to 2,000 cases a day, and every day thereafter would have been a third above that. You know, we're talking about tens to hundreds of thousands of cases avoided with the kind of vaccination levels that we've unfortunately still got at this point in time. Hundreds of thousands of cases would have been our reality. The fact that we're dealing with close to 200 a day is challenging enough. But it is the Delta variant in the face of 35% fully vaxxed eligible population.
But they're the two main contributing
absolutely.
reasons to why it's happening.
Absolutely,
yeah.
in this level of vaccination coverage currently.
One brief last one, sorry. A few weeks ago when the vaccine hubs opened up to 16 to 39-year-olds, the Premier said at that time, keep your AstraZeneca bookings, because if you're in the age group, even if you book for an AstraZeneca, you'll be offered a Pfizer as well. Is that still the case?
No, it's not.
Okay.
No, that was early on. Now it's a case of booking for one or the other at your choosing, but that'll be locked in for you. Thanks all.
Thank you very much.
Thank you.